So the upper trap does what motion?
Upward rotation.
Yeah, upward
And
rotation and elevation of the scapula, right?
Mm-hmm. Scapula
So if I
elevation.
want to just test, say, his left upper trap there, I'm going to have him shrug his shoulder, so lift that up, okay? And then I can push down there. I can also, it's got an attachment on the cervical spine, right? Okay. What other motion happens at the, you can relax here. So what other motion at the neck does the upper trap perform? You guys know? So it side flexes, okay, and it rotates away, okay? So if I want to maximally shorten that muscle, I'm going to have him get into this position, shrug his left shoulder, and then I'm going to hold there, don't let me move you, and apply a force that way and down, trying to separate those two attachment sites, okay?
No, I have a headache.
And I've got a headache with tension. Any questions on that? Great.
In your books, when you go through these, your book's gonna have different variations. Don't think that one way is better than the other. You know, they just have different variations for it. You'll see there's like a preferred method or a different method. It's okay to know a few of them, okay? So.
Okay, next one. Let me have you lay on your stomach for me with the arm hanging off the edge.
left arm.
Okay, do left. Okay, so we're gonna do mid trap. So he's gonna, we're gonna usually ask the patient to do it on their own, and then I know that they've got at least a 3 out of 5, right? Because
Yeah,
that's
because
full range of motion.
if I can only do this, that's not full against gravity.
Yes.
Yeah.
Okay, so then I'll have him, so usually I'll just show them what position to be in. So thumb up on the mid trap, okay? And then I have them just hold that there, okay? Then I can say pretty much that he's got 3 out of 5. I like to kind of palpate, stabilize here, because he's gonna kind of come off the table and when I apply the force. I like to have my hand right on the border of the scapula so I can palpate for a muscle contraction. It also allows me to feel if the scapula moves, because this is really where I'm testing. So hold there for me, please. Don't let me push down. And I apply a force down, and I start to feel a little bit of movement there. The other place where you could have some weakness is in the deltoid, in that GH joint there, where if I push down, it could move kind of it's hard to do, isn't it?
Yeah.
Separate it, but they could have some weakness where the ball and socket moves and things stay stable at the scapula, and that's really what we're testing in this position. Maybe that's a little advanced, but anyways, the position, this is the position. Hold there, don't let me push down, okay? So probably a 4 out of 5 there.
Thanks.
The other thing is your force should be at 90 degrees to the lever arm, okay? That's gonna allow you to not have to work so hard. It allows you to apply the most force efficiently. So just when you're applying force, make sure that you're applying it in see how it's 90 degrees, the lever arm and my point of application, okay?
Also, if I were to do it here, if I do it at the elbow versus the wrist, which one's gonna be easier for me?
Hold there. If I push here versus let the elbow flex, hold here. Yeah, extended, I don't have to push as hard because I have a bigger lever arm, right?
But it's harder for me.
It's definitely harder for the,
So harder at the wrist versus the elbow is easier for me, but.
yeah, so the patient will have an easier time holding this versus this, okay?
I think lower trap, right?
Lower trap? Yeah.
So think about muscle alignment. Those fibers kind of go down obliquely, right?
Muscle fibers, and so I just want to get the arm in line with those fibers. Again, I like to hold here, just to stabilize. Hold the arm right there for me, please. Don't let me push down. Fight me. Go, 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 go. Okay, good. These muscles are not like super strong. In a lot of people, they're really actually pretty weak. A lot of people don't work them, so it's not going to take a lot of force. All right. So
the other thing is, a lot of times too, if you test somebody at end range, and we talked about end range as kind of our weakest point, sometimes to get a good contraction, you have to be like mid-range. So if I go all the way to the end, I'm gonna be weaker there versus like mid-range here. So sometimes you may have to lower somebody down a little bit too. So.
all right. So lower rhomboids.
Mm-hmm.
So the rhomboid test, there's a couple variations on this. So we can put the elbow into extension like you're doing a row, okay? And then what you're gonna do is you're gonna push into basically flexion and abduction. So you're gonna stabilize here, feel for those rhomboids, and hold for me. Okay. And I can feel the contraction right up underneath there.
Yeah, you'll notice Kendall has that seated position one in the book, which is okay, but it's not against gravity, right? So that's why sometimes getting prone is a little bit better to kind of figure that out. So.
And the patient's more stable in this position too.
Yeah.
I think they also have an alternate position with thumb down. It's like the mid-trap test.
Yeah, but it's some, yeah.
Yeah, but I don't know how supination, I don't know, a little bit of rotation.
Yeah.
They're dead now, so we can talk bad about the Kendalls.
You see that book's from 2005, right? Yeah.
All right, anterior deltoid. I guess it's just flexion here is how they show it.
I think
in
they
the
have
book,
it like this in
with
the
the
book.
elbow bent.
Yeah,
Yeah,
and I
that
think
makes
you're
sense.
flying.
Yep, so we're flexing the elbow to take out like the bicep, but you can't really take some of the muscles out. So elbow flexed. Again, hold there, don't let me push down. I'm gonna stabilize here to where I can feel contraction in the muscle, hold. Whoa, how'd that happen?
Being a good patient.
That's right. All right, hold there, don't let me push down. Fight, fight, fight. Okay, so that's anterior deltoid. What else did we do? Did we do lateral or?
I think we had posterior on there, but you already kind of went through posterior deltoid.
Yep. Middle deltoid supraspinatus.
So middle deltoid, right?
Yep. So go take them into abduction, hold there, stabilize, don't let me push down. Fight, fight, fight. Okay.
Does it have to be like this, or do you go like this?
So that's what this is what your book's gonna do. But yeah, if you want a longer lever arm, I would go out all the way into abduction. And I usually, for a healthy population, I will do that. But some people will be like, that really hurts. So then I'll bring them in to maybe get a better test. So it depends on the individual. So
Yeah, it's really variable.
athletic populations, you probably want to be longer lever
Yeah,
arms.
big dudes, you're small, you know.
Yeah.
You just, that's why it's so.
Yeah. Also, going on that, the harder you push, the harder it is for the patient. So you don't want to like push it with everything you got because I got a 3 out of 5. Like, what the heck? You just beat me up. Use 2 hands and push down, and then you're standing up, pushing down. So you have to think. You got to be reasonable. Now, if I'm going to test both arms, I use the same arm both times. So I go to test with my right arm. I want to go to the other side and test with my right arm. Because if I go with the left arm, then my arm dominance will affect the ability to get a similar test. And I can say one side's weaker than the other based upon if I was right-handed or left-handed. So you want to keep things consistent.
Okay, great. Looks like sub-scan. So we're going to get the patient in a couple positions. We get him behind the back. Okay. And then we can give him some pressure anteriorly or toward an anterior type of force. Okay, hold there, don't let me push down. Okay, like that.
And he's pushing that way, and my elbow's pushing backwards.
Okay. The other one is we can just have him do a lift-off test. So he's going to lift away from his back, and then I'm going to hold it there. Don't let me push in. So I'm going to give him pressure here. Hold, 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 and try and take him.
Yeah.
So that then you had one for the
So that would be like
other fibers.
You'll see different variations in research. This would be like for lower fibers of the subscapularis. If we want to do like upper fibers, we call it like the bear hug test. You go across and like I'm patting myself because that's internal rotation. And so he's just going to stand in front and just try to take my hand off my shoulder.
So hold there. Don't let me move you. Go, go, go.
Yeah.
So I'm resisting internal rotation.
It's a good one. All right.
This is a good one. Serratus anterior. Let's.
Supine.
Yeah, serratus anterior. And the book shows the punch on this.
Yeah, so it does protraction, right?
Okay, so protraction is this position, right? All right, and then basically what you're doing is, so if I just push down here, may get some elbow flexion, the shoulder may be unstable, so give them a little support here, hold there, don't let me push down. Go, 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 go. Okay, I like to lean into it. This is hard. I can't get over them maybe enough. Okay.
You'll see that the wrist should be actually a little bit, they want it rotated in the book a little bit, so.
They want to rotate
Yeah,
it
just a
into-
little bit.
Okay.
Yeah.
All right, so that's serratus anterior.
There's an alternative position for that. Because the serratus anterior assists with what scapular motion?
What'd you say?
Yeah.
Upward rotation.
Actually,
Yeah.
upper rotation.
Yeah.
Yeah.
It's
So-
actually more active up here, isn't it?
It is. So you go to about 120 degrees, or 100. This would be 90. 120 degrees, 130 degrees of shoulder flexion or scaption, and then he's going to feel back where the serratus anterior is,
Okay, right in here.
and he's going to provide his force there.
All right, hold there.
Mhm.
Go, 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 go. All right.
Mhm.
Can he hold it? I'm looking for
If
movement.
winging of the scapula is coming off the rib cage, it's not moving. In all honesty, from documentation standpoint, it's very hard to make clinical judgment putting on a manual muscle test grade. I usually look for quality of contraction and movement. And that's how I usually document it. Like serratus is not firing, it is firing, I lack upward rotation, stuff like that. So, pecs, right?
We can do pecs. Yeah, we got bicep, tricep too.
Okay.
All right, so pecs. So we got the sternal and then the clavicular portions, right? Okay. So what movements does the pec do? Pec major?
Internally rotate
Okay, internally rotates
the shoulder.
the shoulder. What else?
Compress.
I'll give you a hug if you answer this right.
Horizontally above.
That's correct.
Okay, good.
Yeah. Negative your mug.
Social hugs, air hugs, air hugs. Yeah. Okay, so for the pec major, I don't know how the book shows position. I'm not gonna do that way. I'm gonna stabilize over here, grab right at the distal humerus. All right, hold there, don't let me move you. So I'm going to horizontally abduct, okay? And that would be which portion? Fiber alignment. Sternal portion, good job, okay? So if I wanted to do the clavicular portion, yeah, we just changed my line of pull, right? Okay, so hold there, don't let me move you. Fight, fight, fight. Okay, is that how the book shows it?
They have a little different variation, but clinically
That's how I would do it in this
Should we
one.
document both?
Document both. Most of the time, you're probably not gonna have,
a weakness in that area.
yeah,
Unless they have like a rupture of that tendon.
yeah.
Like,
Most people are jacked on their pecs.
I've had a few firefighters and bodybuilders who have actually ruptured that tendon. So they'll be weak in usually both portions at that point. So
So what causes, like, sometimes I see like videos of like these bodybuilders lifting so heavy, like where just blood starts coming out of their skin.
I don't know about that.
I swear, it's just like,
It's probably a
they
problem.
just start deadlifting and then like just blood just starts coming out.
That's
That's a
That's
not
too
I'm
much.
gonna say
normal.
that, I don't think that.
Yeah.
It's not natural.
no, it's not, it's not
Yeah.
good. That's not good.
I just a random thought.
What kind of videos are you watching?
No, it's on Instagram. I follow a bunch of that stuff.
Gotcha.
Okay.
Gym filmation.
I think so. We got biceps. now?
Bicep, tricep, yeah.
So we want to do the 3 that we did in class.
Yeah, that'd be great.
Yeah.
Okay, so bicep, so what movements does a bicep perform? It really affects 3 joints that we've learned, right? So bicep brachii, what are our movements? What's the action?
Cork in the bottle. Late night studying.
Well, we know one of them, right? How do you work your biceps, man, at the gym? What do we do? Okay, supination,
Flexion.
flexion of
The elbow.
elbow, and it has affects one other joint. Remember, it crosses where's the origin? Up here, right? Crosses the shoulder joint. Remember that superior glenoid tubercle, right? And then the coracoid process, right? So it flexes the shoulder, the elbow, and it supinates the forearm. Okay? All right, so we get them into supination, all right? Mid-range there, hold there, don't let me push down. Fight me. Go, 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 go. Okay? And then if we put them into a neutral supination pronation position, what are we testing here? Or trying to weed out a little bit.
Brachioradialis.
Yeah, brachioradialis, perfect. Hold there, don't let me push down. Fight, fight, fight. Okay, good. And then if we pronate him, what muscle are we trying to focus on?
Tricep.
No, not the tricep.
Brachialis.
Brachialis, perfect, good job. Hold there for me, please. Go, go, go. Okay, good.
Triceps.
Triceps, I think they had them laying down, supine. All right, so we get them into supine because we want it to be against gravity. So we want, so we get them into the shoulder into close to 90 of flexion, and then we get the elbow into kind of a mid-range position. All right. Hold there. Don't let me push down. So I'm gonna have them fight. Okay. And resist the tricep.
The book's gonna have an alternative.